everyone. Welcome to the Glow podcast. I am here with a very exciting guest today. I have Todd here, and if you're new, we are Tailored Marketing, and we help healthcare businesses and practices grow and increase their revenue through strategic marketing strategies. So if you're interested, drop a comment below. Todd, I'm so excited to have you here today and kind of talk about your career in healthcare and neuropathology. And so I guess I would just want you to kind of go ahead and introduce yourself so the listeners know who you are and have a little bit more information on your background.
Sure. Well, thanks for inviting me to speak to you and your guests here today on this lovely podcast. So I'm Dr. Todd Born. I am a naturopathic doctor and a certified nutrition specialist, and I graduated from Bastyr University in 2010, and I completed my residency in Bastyr Center for Natural Health. It's 13 teaching clinics with rotations in 2 emergency medicine departments, the Virginia Mason Department of Physical Medicine and Rehab Spine Clinic, and I was also at Swedish Hospital's Department of Family Medicine and their sub-department of Integrative Medicine. So I kind of have a little bit of a unique experience in that it's a lot of conventional medicine, integrative medicine, functional medicine, and naturopathic training, and I completed that at the end of 2011, and now here I am. Every time I say it 15 years later, I can't believe I've been practicing that long. So I see patients, all over the world, all over the United States via telehealth.
Awesome. Yeah, no, that's super, super cool. And I guess for my listeners who aren't super familiar, could you talk a little bit more to how neuropathic medicine is kind of different from our conventional Western medicine?
Right, they're starting to get overlap, and it also depends where you practice in the United States. Like I practice in California, we practice in the Seattle area, we practice in Connecticut, and they're all kind of different, which surprised me as far as integration, acceptance, training. Naturopathic medicine has the same basic sciences as conventional medicine for 2 years. Then we take our board exams, just like conventional physicians, eventually trained physicians. And then we have another 2 to 3 years of clinical, they call them clinical classes, which are your systems-based medicine, cardiology, all that. The difference is in that our didactic course is a little longer than conventional medical school because in addition of pharmacology and minor surgery, we're also learning botanical medicine and homeopathy and diet nutrient therapies and counseling, and the list just kind of goes on, and Ayurveda and traditional Chinese medicine. And then it's the philosophy is really the main difference in that, not to knock my conventional colleagues, I trained with them. Some of my best friends are conventional doctors, DOs, and MDs, a lot of conventional physicians in my family. But the main difference really is this thing we call a therapeutic order, which is where we have a patient, we try to meet them where they are, and we follow the least invasive, least aggressive treatment interventions first, saving drugs and surgeries last resort. Sometimes, that's what you need, right? Someone's got, say, a blown out shoulder, they've got a grade 5 tear of their supraspinatus tendon. Yes, can naturopathic medicine help, injections help, but they really need surgical repair. And then you can come in with naturopathic support, which I do all the time, so they heal faster, stronger, and less pain medications. But in medicine, you are starting to see, especially the newer generation of physicians coming out of med school, where they're getting more into the idea of functional medicine or integrated medicine. Only a few of the medical schools, conventional medical schools, offer them, and they're all as electives. I mean, if you talk to most conventional doctors, they'll say their exposure to nutrition is usually a dietitian that comes into their biochemistry class their first year of med school and gives a 2-hour lecture, and that's it.
Yeah.
I mean, I talk to gastroenterologists all the time that tell me, or I speak at medical conferences, and they're like, there's no way that someone's diet has anything to do with their ulcerative colitis. And I'm like, how could that be? I mean, that's, something that's going into your gastrointestinal tract. But since modern science, modern medicine, studies are coming out, it's evidence-based, they're becoming more believers, but there's still a pretty big divide, generally speaking. Conventional physician saying, oh, it's drugs and surgery only, and that's the only thing that works. Everything else is snake oil, but you are seeing some merging of that, and that's really kind of where functional medicine is booming.
Yeah, no, that totally makes sense. Yeah, I've definitely seen it more, even just with the people that I talk to. More people are bringing up integrative and functional medicine, even dermatology practices are becoming integrative dermatology practices because they're realizing that yeah, all the stuff we're putting in our bodies, our environment is actually affecting us in a bigger way than we once thought. And what do you think, like, besides, I guess, the evidence base that is coming out, what do you think is to blame, I guess, or not blame, but I'm trying to think of a better word for more of this integrative approach from people who are practicing conventional medicine?
Right. It's a good question. Part of it is that it's not even that conventional physicians want to practice this kind of medicine, is that patients are demanding it. So they
Yeah.
feel like they need to educate themselves, which is the right way to go. And I even see this in conventional, um, websites that I subscribe to, like Medscape. They'll have podcasts, they'll have webinars, they'll have articles about, doing your due diligence. So you can at least guide the patient. Just because something is available over the internet or it's natural doesn't necessarily mean it's safe. You need someone who actually has training like me that really know what they're doing. But because lots of things are so over the counter, that people think it's safe. The the major woe, right, is that people are sick and tired of being sick and tired. And I always thought, that the United States healthcare system was broken. Everybody knows it's broken. I mean, surgeons will
Yeah.
tell you it's broken. Everybody tells you it's broken. We know it's broken. And the insurance industry is mostly to blame for that, in that they pay the doctors less. Patients have higher deductibles, higher copays, and yet, they're making billions of dollars. I mean, you never hear of an insurance company going bankrupt. And it's
Yeah.
not that we don't need the insurance system, it's just the United States model is an insurance-based system and it pays well for procedures. So it's not really in a physician's best financial interest. Even like psychiatrists, for example, very few psychiatrists do counseling therapy anymore because you don't get paid well for time. You get paid well for procedures and doing high volume of people. So when
Yeah.
I see patients in other countries, I'm always shocked that, their systems are just as broken as ours, especially in socialized medicine, right? Yeah, it may be cheaper to them, but they have to wait 6 months for an ultrasound. Or they have to wait for this, they have to wait for that. The advantage that I'm seeing in many of these countries, though, compared to ours, is that self-pay is cheaper. So they're like, that's fine, I'll get private insurance that's cheap. Or I need an ultrasound, I'll just go to the local clinic and I'll get the ultrasound for $50 US. You can't really do that here. So
Yeah.
given our model, right, to see people in this 7 to 11 minutes because insurance is reimbursing so low, operating costs are so high. I've rotated through hospitals and, I mean, I've seen estimates that 40% of a hospital's operating budget is the billing department. Chasing people for for payment, chasing insurance companies for payment. Insurance companies are not in the business to pay, right? They're in the business to save themselves money so they can pay their executives tens of millions of dollars, right? I mean, just
Yeah.
look at the top 12 health insurance companies and look what their executives make. It's crazy. So
Sickening.
it is sickening when you're like, oh, you made $25 million as your base pay, and then you made another $15 million in your stock options, and it's like, yet you're denying someone's chemotherapy because it's experimental, things like that.
Yeah.
And I practiced in Connecticut, right, the insurance capital of the United States, and I saw a lot of executives, and they gave me a lot of insight on to the business ethics and tactics or lack thereof. And some of them were just like, I can't even do this anymore. I'm leaving. I can't because of morals and ethics. I'm leaving Aetna. I'm leaving United Healthcare. So because people are going in, they're more complicated. The American model is very deft and very skilled at acute and chronic, not chronic, acute and emergent and urgent care, right? We have the best emergent care in the world. But when it comes to chronic disease, which is what most people suffer from, we're abysmal. That's why if you look at these health statistics, we're ranked in among third world countries in quality of life and healthcare. But we're great in emergency departments and urgent care and acute care because you either survive or you die. But
Yeah.
chronic disease, when you come in and you got a problem that's this long and you're seeing your GP and you're in there for 11 minutes and then the GP doesn't really do what they used to do, right? Where they would manage a lot of the moving parts. Now it's like, oh, that's thyroid, you go to endocrinology. Oh, that's your gut, go to gastro. Let your shoulder, go to orthopedics. And so people are tired. They're just polypharmacy. And now they're like, I want someone to look at me holistically and treat me and actually get me better. And that's where you see this explosion of naturopathic and integrated functional medicine because patients want it. So now the medical system has really no choice, right? Because it is a business to, comply and start getting
Yeah.
people to be more aware and better training. but insurance doesn't pay well because it's time based. So most people don't even, like me, don't even accept insurance anymore because it just isn't worth it. You can't even pay your medical school loans back doing it that way.
Yeah, no, for sure. I mean, I feel like you brought up so many good points just with like our healthcare system being broken and like we as like a patient myself, like you see that your doctors they're not necessarily into like preventative care, like of like, okay, how are we going to prevent these things from happening? Like, let's look at your diet, let's look at your lifestyle, let's look at your stress levels, all of these different things that we know are related to our overall health, and our holistic health. And so I think patients too, another good point that you brought up, are becoming more aware. They're becoming more educated. It used to be a time where it was just, okay, you take kind of like what your doctor says is like
Right.
the word, because you
Yep.
don't really have another source of educating yourself. That's really your only source. Whatever they're saying is, that is the word. Like, and now I think we have a lot of other ways to educate ourselves with being online, obviously, and then social media even too. There's obviously bad things that come from social media and misinformation and, maybe things that aren't true or accurate. But there's also a lot of education being had on social media too.
Right. Yeah. I mean, it's interesting because I see patients from newborns all the way to our seniors, and our seniors are still like what you said, like our parents' generation comes from that time that the doctor is God and what they say is gospel.
Yeah.
And we think just because they have a doctorate, they know what they're doing. And I thought that too until I got into medical practice. And once I got, maybe 5, 6, 7 years into it and seeing thousands of patients, I realized, not to be denigrating or pejorative, but most clinicians just, they aren't very good,
Yeah.
and that's just the sad situation of it, right? They might be good in some little niche or whatever, but I get patients all the time, and that's also who see me, right? People who are super sick, and I'm like, that's misdiagnosed. I mean, even just naturopaths, all clinicians, right? Healthcare providers, a lot of them just aren't very good. So if you get one that's got great bedside manner, is a good diagnostician, talks to you, listens to you, versus just being so busy trying to chart and get to the next patient, like you feel rushed, that's not the doctor you want, right? Even if you're
Yeah.
super healthy, it's like you want someone to sit there and listen to you and talk to you, know who you are. And I see that quite a bit that I'm like, that's just a frank misdiagnosis. I mean, when I
Yeah.
practiced in Connecticut, I had Yale, right, one of the most prestigious universities in the world. I had a patient who went to the emergency room that they missed tetanus on her, and it was textbook tetanus. She came in, she lived in a rural area, she was working out in the barn. I mean, like it literally could not have been more textbook. She was working in the barn. She said she was like shoveling, moving hay and shoveling stuff around. She got cut on a rusty nail. Day or two later, she had jaw pain. She had difficulty moving her arm. And she went to Yale Emergency Department, and I was like, that was right out of residency. I was like, that sounds like tetanus. And then
Yeah.
she was like, yeah, they thought that. They gave me a tetanus shot. I was like, they didn't give you antibiotics? I mean, tetanus shot, just the booster just helps you for future. It doesn't help you when you have
Yeah.
active infection. She's like, well, that's why I'm seeing you. So, yep, ran titers on her through the roof. And in Connecticut, I can't prescribe antibiotics like I can here. So I just said, go to your nearest walk-in. Unfortunately, in Connecticut, these walk-ins are on every corner. I was like, just go into urgent care walk-in and just show them this. They'll prescribe the antibiotics. And she got antibiotics. She was better. And I was like, even Yale missed tetanus,
Yeah.
and I'm like, this is just frank mismanagement in our healthcare system because everybody's in just too much of a hurry and we just see too many complicated patients. But there is a lot of good information. I make mistakes too. I mean, I had a patient that wasn't a severe mistake. I died it's a 9-year-old boy, and he's got a bunch of mold exposure and some mycotoxins, and I was going to prescribe some glutathione and some other treatments, and then the mom found some papers, and she's like, oh, well, he's high in gliotoxin, and I read that he shouldn't be having glutathione, and I was like, oh, can you show me the papers? And this was just like 2 months ago, and I was like, even though it's in vitro in one rat study, the gliotoxin actually sucks in the glutathione and replicates itself and causes more neuronal damage. And I was like, well, see, and I'm glad that that woman did her due diligence, went to PubMed, found some papers, sent them to me. So to prove your point, that's right. There is some good out there. It's just weeding through all the noise.
Yeah. No. And I mean, I feel like I come from like the WebMD generation too, where like you would, have like a little like cut and it had maybe like some infection and you're like immediately going online and it's like the worst case scenario, you know? And now instead people are going to TikTok, which I don't know which one's better, but
Right, watching the influencer, and you're like, "That's gangrenous. That does need treatment." And you're like, "No."
yeah.
It's like my kids. They get like a little paper cut, and they're screaming bloody murder. I'm like,
Yeah,
"You're gonna be fine."
no, exactly. And so I guess going back to a little bit too with neuropathic medicine, what, like, I mean, obviously, like, what are you primarily treating in that discipline? And, like, can it be used kind of for everything? Because it's really kind of just more of a holistic perspective, functional medicine, and, like, what do you primarily see people for within that?
All right, that's also a good question because a lot of people in and I could see where they're going because that's kind of where the American Association of Naturopathic Physicians kind of their slant is that it's all about prevention, right? What is it? An ounce of cure is worth a pound of an ounce of prevention is worth a pound of cure from Hippocrates, but which is
Yeah.
true. And prevention is key, right? You want to prevent things from happening, and like you were saying earlier, we are very much disease-based medical system, right? I even went to a cardiologist, and he was saying that. So a little bit of backstory is that I had a hernia, I had hernia surgery, I had some weird things on the ECG that the anesthesiologist didn't like, and he did cardiothoracic anesthesiology 14 years. He's like, you just had some weird reactions, kind of some things I didn't like to see. Go get worked up by cardiology. So I go get treadmill tests. I see cardiology. He's like, no, everything's great. It's common with the medications you were having. And I was like, so where do I go from here? Do I come in for like a regular stress test or what do I do? He was like, no. He's like, unfortunately, the way cardiology is based, we don't really do anything and we can't really diagnose anything preventatively. We have to wait for you to be
That's,
symptomatic. I was like, you
yeah.
do? He's like, yeah, we have to wait for you to have chest pain, wait for you to have shortness of breath, wait for you to have dyspnea, wait for you to be getting lightheaded from sitting and standing. And he's like, since your ECG and yours was normal and your treadmill test was totally normal, he's like, you just come back whenever you have symptoms. I was like, that's weird. He's like, yeah, I mean, even for all the advances in cardiology, we can't do anything until you're symptomatic. We can't even like work anything up. And I was like, so
That just doesn't seem right.
it doesn't. I was like, well, so you just wait for me to keel over? He was like, yeah, well, hopefully that doesn't happen. And he's like, in theory, he's like, because your lipids are normal, he's like, you could get a coronary artery CT, which can kind of help with predictive risk. And I said, right, but the drawback of that, it's a lot of radiation, and the standard of care is that you have to get them serially for a number of years to show anything. Just one isolated test means nothing. And he's like, well, that's true. And then but you're right, is that a lot of people think naturopathic doctors or naturopathic physicians are just all about prevention, and we are key, right? We want to help, we want to get things before you have the heart attack, or try to
Yeah.
hedge our bets and mitigate the probability of someone getting an autoimmune disease. But it's very much also disease based, which is nice because if I have someone who's very sick with an acute problem, just say an upper respiratory tract infection, our conventional doctors, most URIs are viral based. Well, they don't really have a whole lot of things outside of Tamiflu for influenza. So they're
Yeah.
just like, well, here's some symptomatic relief. And then, of course, secondary bacterial infections. Where naturopaths, I've got this huge armamentarium to make it so you have less severity and less duration. You're less likely to get sick the next time. So it is very much prevention based, but very much disease based, particularly with chronic disease. Naturopathic, integrative, functional medicine, whatever label you want to. Naturopathic medicine is like the larger umbrella term that functional medicine, homeopathy, botanical medicine, all these other modalities can or philosophies fall under. Naturopathic medicine
Okay.
is like the big, larger umbrella. Some people may disagree with that, but then we're just kind of splitting hairs with some definitions. But naturopathic medicine was first. And then, a couple hundred years ago, and everything kind of bore out. Or antibiotics were invented in the 50s before penicillin. All conventional medical schools were naturopathic schools. It wasn't
Okay.
until the invention of pharmaceuticals that they started to kind of now brand. The homeopathic schools went away, and naturopathy got separated. But for me in my practice, right, naturopaths are very well equipped for chronic disease because it is that holistic approach versus the palliative care where you go to rheumatology because you've got rheumatoid arthritis and you just start drug treatment, right? And then this is hopefully we suppress your immune system and maybe you go into remission, you can taper the meds. Hopefully you can, but usually most people don't. So with us, it's this whole systems approach. So for me, it's because now I'm 100% telehealth. I don't do a whole lot of acute care anymore because right? I can't do physical exam. I
Yeah.
can't do point of care testing. So it's all just complex chronic, not all, but mostly complex chronic disease. I do see people with just diabetes or thyroid issues, but I tend to see people who've got, a million more problems and they're very, very sick. And that way I can take like an onion, just keep peeling away the layers one after another.
Yeah. No. So it sounds like when you're kind of creating like treatment plans and things for people, you're looking at like their whole lifestyle basically of like,
Everything.
okay, yeah, exactly. And it's not always like, what are we going to add? Because, like, I feel like with traditional medicine, it's a lot of times like, okay, are we going to add in like a pharmaceutical or are we going to have surgery? But it's also like, what can we like take away kind of?
That's right. So typically with people, autoimmune disease, I'll just keep going back to it because it's easy for people to relate to and understand, but also because
For
it's
sure.
multifaceted, multi-system. So for me, it's like looking at the gut microbiome, looking at a person's diet, lifestyle. I would say I've never seen a skin issue, for example, whether it's atopic dermatitis, eczema or psoriasis or sebderm or whatever it is, lichen sclerosis, lichen planus, that does not have a dietary comp. And
Yeah.
dermatologists will say no, or like we were the analogy earlier to someone who has irritable bowel disease. There's always a dietary component. So we do the
Yeah.
allergy elimination diet. We do stool microbiology testing to look at healthy flora and pathogenic flora. And this isn't just some weird esoteric naturopathic thing. I mean, this is well bore out in the science. I just read an
Yeah.
article yesterday about chronic pain on Medscape, and there's now 15 chronic pain conditions that are related to the gastrointestinal tract. Correlation doesn't mean causation, but it means, hey, if we address this, clean this up, then people improve, and I see that all the time. So if we want to really get people into remission, or at least off most of their meds and just on one maybe medication in a lower dose, so less side effects, you have to treat everything. And yeah, you got to make sure look at the diet, look at environmental exposures, look at you know their social support. Like if someone's in a toxic job and a toxic relationship, and they're stressed out all the time, it's a lot harder to get them. You can get them here, but to get them up here, you got to do all the points
Yeah.
and you can do it very multifaceted, and that's how I tend to approach things. And most functional medicine, naturopathic physicians tend to do it that way as well.
Yeah, no, I think it's such like a cool approach, honestly, like bringing in actually your whole lifestyle because like, I mean, who would have thought like what we're putting in our bodies is actually affecting us, you know?
Wow, I know. It's like it always takes like modern science. I remember I was lecturing at the National Arthritis Foundation one time in California when I had a practice, and it was myself, a rheumatologist from Stanford, and a dermatologist from UCSF, and we each had they asked me to come and give like the naturopathic perspective on arthritis, just all kinds of arthritis, osteoarthritis, rheumatoid arthritis. So I did this evidence-based talk. I had my 30 minutes. And it was meant for the general public. It wasn't meant for other physicians. There were a few. And then the rheumatologist from Stanford comes up to me, which was nice to hear, but she was like, "That was an amazing presentation." I said, "Oh, well, thank you." She's like, "Really eye-opening, and I loved your references." And I said, "Yeah." And then she kind of got on her soapbox, though, her platform, and was like, "Well, at Stanford, we're actually doing trials right now showing what effects the allergy elimination diet has on rheumatoid arthritis." And I was like, well, that's great. But in my head, I'm like, I just went through like 5 double-blind randomized placebo-controlled trials on the allergy elimination diet and how it affects RA and some other autoimmune conditions. It's already
Yeah.
been proven. But at Stanford, I'm like, you're already showing what's already been proven, and you're acting like this is you guys are leading the charge in this. But I was like, oh, that's awesome. I'd love to see the results of your trials. But that's kind of where we are in medicine, right? That naturopaths are kind of down here. But you're right, is that you've even seen in the media lately, everybody's now all about microplastics and how they
Yeah.
cross the blood-brain barrier and how we can't get rid of them, but there are ways to get rid of them. And yeah, lo and behold, our environment is causing a lot of problems. I mean, the toxicants are everywhere.
Yeah. No, for sure. And then like the micronutrients in the soil, like there's so many things that people are find like or at least that we're hearing about now. I'm sure that we've known about this for a little while, but we're kind of just now starting to hear about it and like with the example that you were just talking about kind of like okay, we already have this information, and like, why are we doing more studies on it? Like, if we already know that this exists, like, do you kind of think that sometimes with that type of stuff, like the ego plays into it almost, like with like these researchers and doctors, kind of? Because like, I mean, that's a normal thing. It's human nature, obviously. Like, you want to be right, and
Right.
sometimes you
Right.
do things that maybe don't make sense to like be right almost.
Right. No, I agree. Sometimes when I make, like, I remember probably, I don't know, maybe 5 years ago, there was a study that came out of Harvard, and it was like this landmark study, and it was all over social media, it was all over everywhere, that yes, caffeine does induce an ephemeral, a short-term burst of alertness and cognition and, ability to focus. You
Yeah.
know, everybody knows that, but Harvard did the study, and probably spent $50 million on it for our government money, our taxpayer dollars to prove
Yeah.
something or show something. And I appreciate it if you want to take something that's been studied over and over, and now we're like, hey, let's take us to the next level and
Yeah. Or
maybe
like,
take a
let's
disease.
do something a little different or
Yeah, or
whatever.
take a disease population. Like you'll see this quite a bit with a specific carbohydrate diet, where anecdotally it was invented, I think, in the 80s by a nurse whose son was really, really sick. This is before we knew anything about Crohn's disease or ulcerative colitis. And she wrote a book called Breaking the Vicious Cycle. And, it was observational that grains can cause these issues. And the University of Washington has kind of picked up the baton and run a number of trials, mostly in pediatrics, and they keep taking those trials, but instead of doing the same thing, University of Washington, one of the leading research powerhouse institutions in the country, they're like, okay, let's maybe do a larger population. Let's do it blinded now. Let's do it
Yeah.
with an older age group. And they just keep showing over and over, no matter who you're doing this to, it's actually working. There was just a study that came out last year. It was equivalent to putting people on something like Pentasa, these 5-ASA drugs for individuals who have ulcerative colitis and Crohn's. It was just as effective by using this specific carbohydrate diet as these medications with no side effects. So those things I'll be
Yeah.
happy to have my tax dollars go to, but you don't need to do a study to show me the caffeine increases alertness. We know the caffeine increases alertness.
Yeah. No, I completely agree with you. And like, yeah, there's certain things that it's like, okay, yeah, this makes sense why we're doing it, but then other things, yeah, like the caffeine, it's like, okay, we know that just from drinking our coffee in the morning, we don't need to spend money to test this out.
I know, but like you said, but it has to come from a institution, and people have to say, well, it's Harvard did this study, or Stanford, or UCSF. I'm like, we already know that though, and those were high quality trials before. So do something a little bit more helpful for clinicians to then use that information.
Yeah, no, for sure. I completely agree. Well, let my audience know kind of where they are able to find you online, where they're able to connect with you. I know that you do telehealth as well, so if you kind of want to just talk to that a little bit more as well.
Sure. So the name of the practice is Born Integrative Medicine Specialists. You can type that into the URL or just Google my name and then Dr. Todd Born, and then I'll come up, or Todd Born ND. I populate there this, that, and the other, and I do a lot of speaking, mostly at medical conferences and some podcasts and webinars, but some things like this for the general public, and that's where I get a lot of patients, particularly in Europe. I might be on a European podcast, or something went on YouTube, like especially during COVID, right? There were no in-person conferences, so they're all either live streaming or pre-recorded, and then they might be thrown on YouTube by the medical agency that put on the conference. And some of them are on websites, and some of them will be like, "Oh, I saw your presentation on ADHD," and I'm like, "Well, wait, what, you did?" And then they were like, "Yeah." It was the New Hampshire Association. It was on YouTube. That's where a lot of people end up finding me. Mostly it's all referrals from a friend, a family, loved one. But yeah, I moved to telehealth 100% in 2018, so before COVID. After we sold our California practice, my wife and I sold that. She's also a naturopathic doctor. And so now I would say probably 70% of my practice is the United States, 30% is international. So Europe
Okay.
and North America and Australasia. So yeah, pretty easy to find me.
Cool. Awesome. I'll also include everything in the show notes as well. Thank you so much for coming on. I really, really appreciate it.
Sure. Thanks for the conversation. See you, Tyler.